Welcome to the State of Hawaii Title V Priority Summary. This is the fifth year of a 5-year reporting period. Due to the novel coronavirus disease 2019 COVID-19 pandemic, many planned FY 2020 activities were delayed or postponed due to COVID. Based on continuing needs assessment, several priority strategies, activities, and measures were revised in the 5-year plan in response to ever-changing pandemic conditions in partnership with community stakeholders. All programs continue ongoing assessment activities to engage stakeholders, families, and youth through the new environment. Hawaii selected at least one priority health issue for each of the 6 Title V population domains moving across the life course. For women and maternal health, Hawaii selected promotion of reproductive life planning. For perinatal infant health, reducing infant mortality through breastfeeding and safe sleep promotion. For child health, developmental screening targeting 0 to 5-year-old oral health and prevention of child abuse and neglect. For adolescent health, the focus is to improve health, safety, and well-being through annual wellness visits. And for children with special health needs, the focus is transition from youth to adult healthcare services. For the optional cross-cutting and systems building domain, the priority selected is to improve the use of telehealth across FHSD programs. Since FY 2020 marks the last year of the Title V 5-year project period, this year's report provides an opportunity to highlight 2 to 3 key accomplishments achieved during the plan period by domain and priority. Domain: Women's and Maternal Health. Priority 1: Promote Reproductive Life Planning. The strategies for this priority reflect in part the work of the Hawaii Maternal and Infant Health Collaborative, HMIHC, which provided leadership for women's health and perinatal issues in the state for the past 8 years. Title V helped establish HMIHC and is part of the organization's leadership team. The Title V strategies are: promote women's wellness visits through systems building, promote pre- and interconception healthcare visits, promote reproductive life planning. Key accomplishments include implemented 2 evidence-based strategies from the MCH Bureau Infant Mortality Learning Collaborative that improve access to healthcare and reproductive decision-making, promote use of the One Key Question screening approach, and increase accessibility to long-acting reversible contraception, LARC. Medicaid provider policies promoted use of One Key Question by eliminating prior approval to expand contraception coverage and allow for 1-year contraception prescriptions, unbundling LARC from delivery charges and hospital stocking. Trained over 1,000 healthcare and service providers in One Key Question curriculum, and most Hawaii birthing hospitals now stock LARC for same-day access. Plans include continuation of One Key Question provider training targeting primary care providers, evaluation of the Medicaid and state contraceptive policies, development of public awareness messaging on healthy behaviors, and integration of One Key Question into new reproductive health services, request for proposal scope of work. Domain: Perinatal and Infant Health. Priority 2: Promote breastfeeding. Within FHSD, the Women, Infants, and Children WIC Services Branch is the lead program promoting breastfeeding, serving half the births in the state. Strategies focus on strengthening WIC breastfeeding programs, including the Peer Counseling Breastfeeding Program, and increasing partnerships with community-based organizations to expand WIC services to underserved populations. In addition, broader systems building activities are being implemented through statewide collaboration and networking. Key accomplishments include completed and continued implementation of the State Breastfeeding Plan, expanded WIC community-based provider network to increase service availability and access expertise to reach underserved high-risk populations, provided updated breastfeeding and COVID-19 information during the pandemic for community responders, healthcare workers, and the public. This priority is being deleted in FY 2021 since Hawaii has met both Healthy People 2020 breastfeeding target objectives and Hawaii rates for these measures remain generally high. The Breastfeeding National Performance Measure will be replaced with a new state priority on food insecurity, which has increased during the pandemic. This new initiative will be led by the WIC Services Branch in partnership with the Hawaii Children's Action Network. Priority 3: Promote safe sleep practices. The supervisor for the Family Strengthening and Violence Prevention Unit under Maternal Child Health Branch serves as the Title V program lead for Safe Sleep. Title V funded staff provide branch-level leadership and overall support for program efforts, including liaising with the statewide coalition that promotes safe sleep efforts, Safe Sleep Hawaii. Key accomplishments include promoted adoption of safe sleep policies, protocols, and guidelines, following the American Academy of Pediatrics standards by all the state's 12 birthing hospitals, policy adoption for mandated annual safe sleep training for all state licensed childcare providers, and partner to develop training and educational materials now used widely by programs and agencies serving families with newborns and young children. Partnered with the State Child Care Program and Office of Language Access to translate safe sleep education materials into 11 languages to broaden outreach efforts to high-risk groups. Future plans include increasing awareness of the importance of safe sleep and provide education through public service announcements, digital media, and expanding outreach to non-English speaking families and caregivers through translated materials. Domain: Child Health. Priority 4. Improve early and continuous screening for developmental delay. Developmental screening has remained a continuing priority since 2010 for FHSD, which coordinates federal, state, and local efforts on screening, referrals, and services. The leads are the Children and Youth with Special Health Needs Branch, Early Childhood Coordinator, and the Early Childhood Comprehensive Systems Impact Grant Coordinator. Title V does not directly fund developmental screening program staff and activities, but does support management, epidemiology, data, and administrative positions that contribute to the National Performance Measure. Key accomplishments include completed and continue to disseminate standard guidelines for developmental screening with statewide stakeholders for all programs working with young children. Establish systematic developmental screening data sharing among Title V early childhood programs to assure screening, referral, and follow-up services. Established a community-based model for developmental screening, referrals, and supports for children in Maui County funded by the ECCS Impact Grant. Plans moving forward are to continue work on the ECCS grant that includes the WIC Developmental Screening Pilot, which was initiated to engage families about their child's development. Title V will continue to partner with state early childhood organizations to promote a system of developmental screening and referral. Priority 5. Improving oral health of children. With the loss of sustained program funding, strategies focused on rebuilding the state oral health program, maintaining surveillance and data collection, and supporting the Hawaii Oral Health Coalition. Title V assured ongoing data collection through state surveillance surveys, such as the Pregnancy Risk Assessment Monitoring Survey and the Youth Risk Behavioral Survey. Key accomplishments include completed the CDC State Oral Health Infrastructure Grant, including development of data surveillance plan and publications, and completion of the first basic screening surveys of 3rd grade students and Head Start enrollees. Rebuilding of the State Oral Health Coalition with formal organizational structure, fiscal agent, and working subcommittees. During the early days of the pandemic, the Hawaii Oral Health Coalition shared critical information with dentists on safety protocols and avenues to secure PPE, served as a hub to coordinate bulk PPE purchasing, and hosted workforce trainings. Oral health for children will not continue as a Title V priority due to the loss of the program funding and staffing. Priority 6. Reducing the rate of child abuse and neglect for ages 0 to 5 years. Strategies are to promote safe, healthy, and respectful relationships through public awareness, state planning, surveillance, systems coordination, and workforce training. The Title V Child Abuse and Neglect Prevention Program in the Maternal and Child Health Branch is the lead for this measure. The program is funded by the Federal Community-Based Child Abuse Prevention Grant. Key accomplishments include forge critical partnerships to promote evidence-based prevention practice in collaboration among the state's child welfare services, judiciary, Department of Education, and community service providers, completed the Child Welfare Services 5-year service plan with a focus to prevent children from entering the foster care system, supported statewide efforts to increase awareness about adverse childhood experiences and promote trauma-informed care models of practice, maintained McVie evidence-based services to at-risk families, The Child Welfare Services 5-year service plan will be implemented. Partner agencies also are completing planning for the Federal Family First Prevention Services Act. Home visiting and workforce training services will continue. Domain Adolescent Health Priority 7 Improve adolescent health and well-being. The Title V Adolescent Health Unit in the Maternal and Child Health Bureau is the lead for the Adolescent Wellness Visits Measure. Adolescent Health Unit also administers the Federal Personal Responsibility Education Program, or PEP, grant, and assists with management of state-funded perinatal support services contract. The Adolescent Health Unit Coordinator is partially Title V funded. Key accomplishments include integrated adolescent health information and promotion of annual wellness visits into PrEP, the evidence-based teen pregnancy prevention program serving high-risk youth. Partnered with the Coalition for Drug-Free Hawaii Youth Network to create a youth-designed adolescent resource toolkit available via the Teen Link Hawaii website and supported by social media messaging. Plans include training of community health workers in rural areas on the Adolescent Resource Toolkit to provide health information to adolescents, conduct simple assessments, promote the importance of wellness visits, and link teens to services. Teen Link Hawaii and the Adolescent Resource Toolkit will also be broadly promoted via paid media campaigns that include TV, radio, and digital media. The program will continue to collect input from adolescent and providers on the Adolescent Resource Toolkit to assure its effectiveness. Domain Children with Special Healthcare Needs Priority 8 Improve transitions to adult healthcare. The major strategies for this priority are standardizing procedures and data collection for transition in the Children with Special Health Needs program, promoting statewide education and awareness, and integrating transition services into the standards of care for community programs and agencies via collaboration. Key accomplishments include developed a system for transition planning for those enrolled under the Children and Youth with Special Health Needs section using the evidence-based 6 core elements of healthcare transition, including guidelines, educational tools, workbook, and database tracking. The system model is being adapted by Kaiser Permanente Hawaii for adolescent services. Supported development of an active statewide network of agency and community partners that promote transition services, including the State Department of Education, vocational rehab, and family service organizations through popular in-person events. Many programs were postponed or switched to virtual events in 2020. Plans include incorporating transition planning into Children and Youth with Special Health Needs service coordination for enrolled youth and their families. Other strategies include providing education and public awareness on transition to adult healthcare and promoting the incorporation of transition services into organizational practices in collaboration with state and community partners. Domain, cross-cutting, and systems building. Priority 9. Promote telehealth throughout the Title V programs. Online and in-person telehealth training has been conducted, and telehealth services are being provided through several Title V programs, including genetics, newborn screening, early intervention, WIC, and home visiting. FHSD offices statewide continue using the technology for meetings, provider education, including Project ECHO, used to build the primary care workforce capacity targeting providers in rural communities. Key accomplishments include, led by the Genetics program in partnership with the HRSA-funded Pacific Basin Telehealth Resource Center, provided equipment, software, and training to support use of Zoom across FHSD programs. This laid the foundation for a smooth transition to telehealth and telework during the COVID pandemic. Early in the pandemic, telehealth educational videos and trainings were developed for healthcare providers and families, which were used by HRSA nationally to promote use of telehealth. Established Project ECHO Hawaii with the Area Health Education Center to use video conferencing to build healthcare workforce capacity to improve patient access to specialty healthcare in rural communities. This state measure is retired due to the significant progress accomplished over the past 5 years, particularly evident during the current COVID-19 public health emergency. 5-year plan changes for 2021 to 2025 fiscal year 2021. Several changes in Title V priority selection were made as a result of the 2020 needs assessment. However, further revisions have been made as a result of ongoing needs assessment and changes in funding, resources, and partnerships. Inactive priorities or performance measures. 3 priorities or performance measures will be inactivated in fiscal year 2021. Fiscal year 2020 will be the last year of reporting for children's oral health, breastfeeding, telehealth expansion among Title V programs. This is a state performance measure. New state priorities. 4 new state priorities were added in fiscal year 2021 as a result of pandemic impacts and new federal funding opportunities, all addressing health equity. Food insecurity through WIC services, telehealth expansion to underserved communities, pediatric mental health, child wellness visits, and immunizations. Health equity. Hawaii also integrated a health equity strategy into the plans for any Title V priority without an existing equity component. Activities for the new equity strategies were selected from AMCHIP conference presentations, guidance from the MCH Evidence Center, and MCH Workforce Development Center skills building presentations. The activities for these strategies will be refined with closer review of national and local health equity resources and community stakeholder engagement. Mahalo! We hope you've enjoyed learning about Hawaii's Title V activities. If you have questions, please contact Annette Mente at annette.mente@doh.hawaii.gov.